You're listening to EmpowerTech with me, Iyari Cevallos. This series is a collaboration with Women in Technology, spotlighting the remarkable winners of the 2025 WiT Awards. Across these episodes, you'll hear from outstanding leaders and innovators whose work is paving the way for a more inclusive and impactful tech future. Their stories remind us what's possible when talent, purpose, and determination come together. Dr Aida Brankovich is the 2025 Women in Technology Emerging Tech Star Award winner, a purpose-driven researcher and engineer at the cutting edge of biomedical innovation, leading work at the intersection of AI and healthcare. Her mission is to develop innovative, safe, ethical, and trustworthy AI-enabled clinical decision support tools and medical devices that improve healthcare delivery and patient outcomes. She led the development of AI-based algorithms planned for predicting patient readmission, as well as predictive models for preempting treatment and engaging in digital health programs with enhanced patient support, outcomes, and to reduce costs. During her postdoc at the University of Queensland, Dr Brankovich has contributed to the development of the computational element of a novel portable brain scanning technology for early diagnosis and better bedside management of stroke patients. Aida is the primary and secondary inventor of 2 patents licensed to a third party. The technology has already passed through the first clinical trials and is now in the second stage testing. Beyond algorithms, she led an interdisciplinary team to develop a world-first provisional tool for assessing explainable AI that can clearly communicate how and why it made a decision, addressing critical issues of transparency, fairness, and trust in AI. Aida, great to have you here with us today.
Thank you very much, Iyari, for the invitation. It's my pleasure to be here today.
Really excited to get into it. So let's get started. Can you tell us what drives your passion for the work that you do?
I guess the key thing is the purpose of the work that I'm doing. And another aspect is the curiosity. In general, through my work, my mission is to develop innovative, ethical, and trustworthy AI solutions. And when we are talking about healthcare, it's all about trust. So I think it's really aligning with my vision of my future and my higher goal, I would say.
Yeah, wow. And can you tell us a little bit about your journey to getting into this type of field?
Well, it was quite wiggly. It was not. It was not like directly going here.
So not a straight line.
Not a straight line at all. Curvy line, very much curvy line. I have 2 big loves: music, classical music, and physics.
Wow.
And as a child, I was always gravitating towards the arts and math. And teachers also noticed this. So as a child, I was already in some kind of special programs where I was developing further my skills in math, physics, competing in these fields. And that love for physics in particular was growing on daily basis. Math was a little bit dry, but physics had a soul. And I have to be honest, I could see myself going into the physics, being specific, going into the astrophysics. And through the high school, my teacher told me, it would be better for your future if you would be going towards the engineering. It's kind of applied math, physics, everything that you like, but it is like transferable skill. It's applied. You can do tangible things that could actually help people. And I think she's the guilty one for me choosing the engineering. And then engineering, I was still, I think I like the most those subjects that are really kind of applied physics, especially those related to mathematical modeling. My background is in electronics and systems control, which in very plain English would be something like applied mathematics, making system to work as we want. So in that process, I already knew what what niche I like. And then when it came to my PhD, I started looking for the PhD topic that would be aligned with my interest. And in the second part of my PhD, I was working on one very tough, mathematically tough optimization problem, namely finding the biomarkers in the gene expressions. You would have a lot of genes and you would look just for a few that are important for specific cancer, tumor, or so. So I think that was like a pivotal point, and where I clicked, I want to apply my knowledge to medtech.
Mm-hmm.
And since then, I started looking more towards something later postdoc, where I could work on problems that are within the field of medicine, where I could really contribute with my technical knowledge. So I think that would be the way how I ended up doing what I'm doing. Then the postdoc at UQ. I was working there at a novel technology. The team was developing novel technology, so I came as somebody with the expertise in data science and AI mathematical modeling. So I was contributing there by developing novel algorithms for the stroke localization and detection for the technology that would address some of the shortcomings of the existing diagnostic technologies for the stroke, like CT and MRI. And after that, I got an opportunity at at the CSIRO to move, and I accepted that.
Wow, that does sound like quite a non-straight line. I can hear that you had, particular interests when you were younger, and then you had, I guess, some guidance around potentially applying some of that interest in a broader sense that opened up more opportunities for you. And then, because you mentioned the word engineering, and I'm thinking, oh, okay, you're going down a particular path. And then you've, gotten an interest in sort of medical field. And you pivoted a little bit. So that is quite interesting to hear that that's possible, that you don't, you don't have to stay on a particular lane. And when you were making those pivots, did you ever think or get worried about changing direction?
No, I would say I was going there without any negative thinking or doubting anything. The things were naturally evolving and moving from one thing to another. And I think good thing is that I'm keen to learn new things. I'm curious. So I guess that make it easy, whatever I'm doing. So was it the previous, some of the transitions I had or transitions that I'm doing at the moment, whatever I'm doing, whenever I'm changing something, I think that is the curiosity that keeps me calm.
And so you're seeing the opportunity to continue further learning with that curiosity and seeing that as the kind of guiding principle, as opposed to being concerned about missing out on something if you don't make a particular choice.
I think if we are too much rigid, we may miss a lot of things. And I think when you are open for new opportunities, new learnings, you cannot fail. What you gain is, first of all, personal growth. And then what comes also is new knowledge that you gain while doing that thing. So I don't see any risks in moving into something.
And I'm really interested in something else you mentioned. You mentioned moving on to a particular team. I'm assuming that, I think I heard that you were the only one with the skills that you had at that time.
For this particular task that I've been assigned to, yes.
Okay.
There were still people doing something in AI, but it was more related to vision. But somebody with a more solid mathematical background that would develop algorithm that would meet the constraints of the project. First of all, AI is data hungry, and we didn't have much data, so we need to come up with solution that is feasible and that would work in practice. So, I guess that was my key factor.
And the key strengths that you brought to the team. So in the work that you do today, what is that like? Can you give us a sense of what it's like working in this field that you're in now and what it's like working on this team?
Okay, I'm working now with Australian eHealth Research Centre, which is program of CSIRO. So we are focused on digital health. So anything digital that contributes to the healthcare delivery. Um, so I'm currently in neuroplasticity team working on different projects, mainly related to CP cerebral palsy, applying my knowledge in developing the algorithms that would understand the quality image that would later aid the analysis of these images, and analyzing the myelin in the brain that is associated with risk of CP in children that were born preterm. So this is one of the projects, but where I've been working pretty actively in the past few years is ethical AI. Namely, while I was working on one of the previous solutions in the previous team where I worked, I got results that were not really pointing us in the right direction. Moreover, I understood that the results that we got could raise some ethical issues if they would be used in clinical settings. So actually, that was like a triggering point to start thinking of the project that would try at mitigating those risks. And this is where I put the most of energy in the past 2-3 years.
Wow. And can I ask, can you give us an example of what you mean by ethical?
Well, for example, something that will not cause the risk, damage or harm to the patients. Now, these risks can be of different nature. The care delivery should be equal to everyone. We should treat everyone the same. Decisions that we are making should be quite solid and informed decisions. But the results that I got actually were pointing out that if we would use AI, it could even lead clinicians in the wrong direction, what in turn could have like very bad consequences for the patients. So those were the aspects that I've been trying to address with my research in the past few years.
Okay. So they sound like quite significant impacts in a negative way in terms of using AI in the examples you gave that's quite real world and has real world consequences, not a place that you want to be experimenting in.
Exactly. I can give you an example maybe to be easier to comprehend. For example, explainable AI is something that I'm doing in the past few years, particularly. That's kind of my focus. And while working in that space, okay, what is the purpose of explainable AI? The whole purpose is to rationalize the decision. So AI models are big, complex. We cannot really comprehend the mechanisms in which they are working, how they are making decisions. So scientists came up with explainable AI. It is like top-up layer that should provide you some insights and rationalize the decision of the AI algorithm. So the thing is, when you apply different explainable AI algorithms, they are providing you different outputs, meaning that one can say the cause is X and another say the cause is Y, but taking the action based on these explanations could take you in different directions, different interventions. So what we've been trying to do, and the project that I've been leading, is to quantify the uncertainties and so we can calibrate the trust, to have quantities, to know how much we can rely on that output. So this was the way to, at least to large extent, mitigate these risks.
Okay, yes, that makes a lot of sense. So when we're using the tool, if the tool was on the market for the medical profession and they were, I guess it was helping them analyze something and coming back with results, it could also tell them the level of accuracy that the tool is giving the results in, so that the human in the loop is able to discern the information that's being received. Okay.
Exactly, yeah.
It sounds like there's quite a few, real world challenges in the work that you do. Can you give us an idea of, the length of time that these sorts of attempts that you're trying to make give clarity, transparency on the tools potentially, how long that takes? Because, not many of us get to be in this space, and some of us might think it's quite a simple task, but it sounds like, you've been on this work for a little while now.
Yeah. I think, when I have just started doing a bit more serious things, likely it was early on in my career, I realized that engineering is not enough to solve real life problem, because usually you are in the team with the people with different backgrounds. This means you are talking different languages. I mean, I'm not talking about language literally, but understanding what do you mean, how do you see things, how your colleagues, everybody looks at the problem from their perspective, their background. So it's really important, and I think it's hardest thing to put the people to think together, kind of to see the problem similarly so they can articulate, think in understandable way. So this depends also from the people, from the team, from the experience of the people. And I noticed that people who have worked on a different projects with different teams, I think they have this faster response, is like shorter time to tune. And also it is, for example, when we are talking about clinicians, because I'm working pretty much with them, it's way easier to work with the clinicians who have some mathematical background. It's simpler to click on and understand what they want, because as an engineers and researchers, we should eventually develop solution that will be convenient for them. Mm-hmm. Not what we think is good, but what they need and what will be handy for them. And I think that is one big challenge when we are working on any kind of the solution. Now, when we are talking about pace of development, how stressful it is, I think it also depends on the type of the project you are working on. I have had an opportunity to work on a project with a startup. And the dynamic of the research is wilder than when you are working in a pure academy, or when you are working within some grant that is purely research grant. You have to think quicker. The investors do not think like, can it be done? It has to be done. I mean, you have to find a solution. I mean, it's all about money. While when you are working in a research, though it is multidisciplinary team, I think it's more relaxed. I don't say it's too slow. It's moving with some natural pace, but I think there is more space, like, to be free to have a failure, I guess. Mm-hmm. Say, I don't know, or it can't work. So I think these are two main differences when we are talking about industry-oriented project and something that is purely research. In research, you have to be ready that it may fail, because if the outcome would be certain, then it wouldn't be research. Simple
yes.
as it.
Yeah, that's a really good point. Sometimes research leads us down a path we didn't expect, right? As you mentioned before. Can you tell us a bit more about some of the challenges that you've faced and had, through your career and the work that you like and attempt to do?
Well, I mean, life without challenges is impossible. I accepted that. And I think that is the first lesson we should all learn. So challenges are appearing constantly, emerging, but it's all about how we react on those challenges. In terms of the technical challenges or challenges in working environment, really, as I said, it's not just about your technical knowledge or engineering. There are a lot of other aspects on which you should work. There is important part of the communication, and I think it is one of the most important things when we are working on the teamwork. But also be aware of the human factors, ethics, policy when you are developing solutions. It all brings certain challenges when you are developing a certain solution. In terms of the personal challenges along my career, well, there were plenty of them. Early in my life, I had to learn that knowledge is the only right way to go forward. My mother, she's an engineer too, and lady with very broad view on life. She was always saying like, this is temporary. It will
Mm.
pass away. Just focus on growth, focus on learning. And I think through everything later in my life, I was focusing to learn something from that situation. Um, and eventually everything will pass, good or
Mm.
bad, it will be behind us. So just keep on moving forward. I think that is the only way to live life, to get most of it, and not to be maybe too much distracted by the certain unfavorable situation.
That's a really great perspective that she's passed down to you. And it seems to have done you well in life in terms of what you've managed to achieve and the impact that you've had in your work.
Thank you, thank you. I think my mother had the biggest influence, and if we would be talking about first mentors, I would say that she is the first mentor I've ever had.
That's wonderful. On that note, it would be great to understand if there was a young girl or boy thinking about making a difference like you, what advice would you share with those aspiring to follow in your path?
Um, if they are thinking of pursuing career in the field of AI or related engineering whatsoever, I think they should focus really on math and physics. These are the basics that really make difference. And considering the time that is coming, these two will make difference between those who will stay or who will survive in the field or who will not survive. And something else more important, as Einstein said, be the person of value, not the person of success. This is something that sticks with me always and that I remember always. Sometimes I have an impression that this society is putting a lot of pressure on us to be rich, to be successful, to be pretty. And especially in the fragile age, in the teenage years, it can be quite big pressure. So I think if we can just teach them that they should stick to the values and try to plug them into whatever they are doing in their life is actually the meaning of the life. This is something, and they will be experts of the future. So I would really ask them to be better than us and to work on the solutions that are ethical and that ensure human dignity. And because eventually we are all humans and we have all the same rights, and we should really preserve that.
The same rights and the same needs, right?
Exactly. So we need solutions that will meet human needs while they will also at the same time protect our human rights. And it is on us to set this.
Mm-hmm. That's beautiful. Thank you. Before we wrap up, I'm going to get to your top tips, but I also want to hear about any surprises that you've had through your career so far.
Surprises? Well,
pleasant surprises.
Yes, pleasant. Sometimes you are in the corner thinking like there is no way out. There is no door beside you. There is no window in front of you, but solution appears. And I think that is one of the biggest lessons that I learned, that we are never let alone. Eventually, I learned definitely as far as I have goal that is bigger than myself, no matter how big is the obstacle on the way, I will find my way. On that way, probably I will come across the people I didn't know before who may help me, but I will reach there. So I think in terms of the surprises, that when it happens, like you are completely without any idea how to run out of the situation or how to find a solution, it appears from somewhere where you completely don't expect.
Mm-hmm. And that's a pleasant surprise. Yeah, that's wonderful advice and to pass on to our listeners. It is great to hear that, you can persevere and to not lose hope in the course or the impact that you want to have. So that's beautiful. Thank you. So Really want to hear your top tips for our listeners. We usually close out on the podcast around top tips for our listeners to empower themselves. What I know you've mentioned a couple already, but is there anything you want to solidify or add to in terms of your top tips for listeners?
I don't know, maybe to sum up everything, maybe to put them all together in like top 3 tips.
Yes.
First would be like to be curious, because as far you are curious, you perceive any situation differently. You see it as an opportunity for the growth. The second would be to be person of values and to plug in these values in whatever you are doing, and be brave to stick with that. There will be situations where maybe you are the only one thinking that, but if you are really convinced that it is the right thing, that is morally correct, be strong enough to stand up and survive that moment. And probably the last thing that I have learned recently is that we need to take care of ourselves, of our health, mental, physical. So if we don't take care of ourselves, nobody will. And without being healthy, we cannot actually work on our mission. We cannot work on our ideas. We cannot go towards our goal. So it's kind of prerequisites to reach what we want and have really positive impact, real impact. So these would be top 3, I guess.
Yeah, no, they're great. Top 3. I really like those, especially ending on the self-care, as some people like to call it these days. Without looking after yourself, nobody else will. Totally. Yeah. I'm going to quote you on that one. It was lovely to have you here today. Thanks for coming in. It was great to hear about what you're up to and the advice you have for those listening. It's just wonderful top tips. So thank you.
Thank you so much, Iyari. It was my absolute pleasure to be part of this project.
Thanks for listening today. Do keep in mind that this is a podcast for informational purposes, and all we're really doing is sharing our opinions on things that matter to us. With that being said, if you liked what you heard and want to continue supporting us, share this podcast with your network to help us grow and bring on even more guests. Until next time, this is Iyari from EmpowerTech, signing off.